Have you ever noticed a strange smell coming from your body and just brushed it off as normal? What if I told you that one particular odor, the kind most people ignore or try to cover up with soap or deodorant, could actually be a signal your body is sending? A quiet alarm about something deeper? Something potentially serious? And the most dangerous part? This smell often appears weeks, sometimes even months, before more obvious symptoms show up. By the time people take it seriously, it may already be too late to reverse what's happening. But here's the good news. If you recognize it early and know what to do, you can act fast and potentially prevent a far more serious health crisis. So listen carefully, because the most important tip is at the very end, and it just might save your life or the life of someone you love. Now, most people assume that as we age, it's natural for our bodies to change. The skin gets thinner, digestion slows down, and yes, smells might become a little different. But here's the truth. Not all changes are just aging. Some are red flags, early warning signals that your body is under stress or that certain systems aren't working the way they should. And scent is one of the most overlooked of those signals. Your nose might be the first organ to detect what your blood, kidneys, or even your brain are silently trying to tell you. So, no, this isn't just about hygiene. It's about your health. And here's what I'd love to know from you. How old are you right now? Are you 60, 70, or beyond? Write your age in the comments. I genuinely read and reply to every comment I can. And I want to know, have you ever noticed any unusual smells from your breath, your skin, or even your urine that made you pause? Don't be shy. Your story might help someone else catch a problem early, too. Type 1 if you've ever experienced this, or 0 if you've never thought about it before. Let's dive into the smells your body produces that you should never ignore, especially after the age of 60. These aren't just cosmetic or embarrassing. They can be linked to kidney disease, liver problems, infections, and even neurological changes. And most importantly, I'll show you simple steps to check, manage, or even reverse them, starting today. The first smell you need to pay attention to is a strong, fishy, or ammonia-like odor in your sweat or breath. This can sometimes feel like it's just body odor, but if it lingers after bathing or returns quickly, it could signal a buildup of waste products in your blood. When the kidneys aren't filtering properly, excess urea starts to escape through your skin and lungs. And yes, it smells. This condition is called uremia, and it's often one of the first signs of chronic kidney disease, something that affects more than 1 in 7 adults in the United States, especially over the age of 60. If you notice this smell, especially combined with swelling in your legs, fatigue, or changes in urination, ask your doctor for a kidney function test. In the meantime, reduce your sodium intake, stay hydrated, and avoid over-the-counter anti-inflammatories unless prescribed. These can further strain the kidneys. Now, let's talk about a musty, moldy body odor, something many people describe as old person smell. But that phrase is not just disrespectful, it's misleading. The scientific name for this odor is non-enal, and it's produced when skin lipids break down more rapidly with age. But an excessive non-enal odor can be a sign that your body is struggling to detoxify properly. This often points to poor liver function. Your liver processes fats, filters toxins, and helps regulate hormones. If it's under stress, from alcohol, medications, or fatty liver disease, your skin can take over part of that burden, releasing these strange smells. One simple change that helps support your liver is adding foods rich in bitter compounds, like dandelion greens, arugula, or a splash of lemon in warm water first thing in the morning. These stimulate bile flow and gently assist your liver in doing its job. Have you ever caught a sweet, fruity odor on someone's breath? It might sound pleasant, but in someone over 60, it could be a major warning sign. This is often a symptom of diabetic ketoacidosis, when the body, starved for insulin, begins breaking down fat rapidly. It produces ketones which build up in the blood and spill into the breath, smelling like overripe apples or nail polish remover. While this condition is more common in type 1 diabetes, older adults with type 2 diabetes, especially those on insulin or certain medications, can experience it too. If this smell comes with rapid breathing, confusion, or stomach pain, it's an emergency. But even if symptoms are mild, get your blood sugar checked immediately. And be mindful of signs of uncontrolled glucose, frequent urination, excessive thirst, and fatigue. One tip: eat balanced meals that include fiber, protein, and healthy fat to avoid blood sugar spikes. And try a gentle daily walk after meals. It helps your muscles absorb glucose more efficiently. Another one many seniors notice but rarely talk about is the smell of sulfur, like rotten eggs, in their breath or gas. This can indicate digestive trouble, especially if it's accompanied by bloating, irregular stools, or discomfort after meals. As we age, stomach acid levels tend to drop, leading to poor digestion of proteins. When food ferments in the gut, it can release foul-smelling gases. Low stomach acid also means less absorption of key nutrients like B12 and magnesium. One easy fix? Try adding a tablespoon of apple cider vinegar in a glass of water before meals, but check with your doctor first if you have acid reflux or ulcers. Also, chewing your food thoroughly and eating slowly can reduce gas production and improve digestion more than any pill. Now here's one that might surprise you: the smell of bleach or chemicals in your urine. This could indicate a urinary tract infection, which in older adults doesn't always cause burning or urgency. Instead, you might feel fatigued, foggy, or just off. Some people even report smelling something metallic or bitter in their urine before they realize they're sick. Left untreated, a UTI can spread to the kidneys or even cause confusion and falls in seniors. So, if you ever notice a new or strong chemical odor in your urine, especially with any discomfort or color change, get checked. Drinking more water, cutting back on sugar, and urinating after intimacy can help prevent infections. And don't hold in your urine for too long. It gives bacteria time to grow. One subtle but important smell is a smoky, burning scent that has no external source. Some seniors report smelling this when there's nothing around that could cause it. No fire, no cigarette, no burnt food. This phenomenon is called phantosmia, and while it can have many causes, in older adults it may be linked to neurological changes. In rare cases, it can be an early sign of Parkinson's disease, epilepsy, or even brain tumors. But more often, it's caused by sinus infections, polyps, or a side effect of medications. If you experience phantom smells, especially if they're persistent or disturbing, talk to your doctor. They may refer you to a neurologist or ENT specialist. Keeping your sinuses clear with nasal rinses and staying well hydrated can sometimes help reduce these episodes. Then there's bad breath that doesn't go away no matter how much you brush. This isn't just a social issue. It can be a sign of gum disease or even stomach problems. Chronic bad breath, or halitosis, is often caused by bacteria trapped in the gums or tongue, but in people over 60, it may also signal reflux, hiatal hernia, or even stomach ulcers. If you use mouthwash regularly but still notice odor, consider switching to one that includes zinc or chlorine dioxide. These target sulfur compounds directly. And don't skip your dental checkups. Oral health is directly linked to heart health, and infections in the mouth can travel through the bloodstream to affect other organs. Another smell that deserves your attention is the odor of stool or decay on the skin, particularly in skin folds, under the breasts, or in the groin area. This isn't just poor hygiene. In older adults, This can be a sign of a hidden skin infection, often fungal, that thrives in moist, warm areas. It may look like redness or irritation at first, but if ignored, it can break down the skin barrier, allowing bacteria to enter. In some cases, it can even lead to cellulitis, a potentially dangerous infection that spreads quickly. The key here is prevention. After bathing, gently dry all skin folds thoroughly. Use a clean, soft towel and consider applying a non-talc antifungal powder to areas that tend to sweat. Also, wearing breathable fabrics and changing undergarments daily can make a big difference. If you ever notice a strong odor in these areas, especially one that doesn't improve with washing, get it checked. Early treatment is simple and effective, but delays can turn it into a serious issue. Now let's talk about a sour or vinegary smell on the body or in clothing. This often points to a buildup of acids in the sweat, which may be linked to metabolic imbalance. In older adults, one common cause is low-grade dehydration. As we age, our sense of thirst dulls. That means by the time you feel thirsty, your body may already be running dry. Dehydration concentrates the salts and acids in sweat, which can change how your body smells. But there's more. Dehydration affects brain function, blood pressure, kidney health, and even mood. The fix is simple, but you have to make it a habit. Aim to sip water throughout the day, not just during meals. And if you're on a medication like a diuretic, talk to your doctor about your hydration needs. They may differ. One way to check your hydration is by the color of your urine. It should be pale yellow. If it's dark, your body's asking for water. Some seniors describe a metallic or bloody smell in their nose, often when there's no visible bleeding. This can be due to dry nasal passages, which are common in drier climates or during the winter months when indoor air is heated. But in some cases, it can be a sign of high blood pressure. Tiny vessels in the nose can break when pressure spikes, and you may not see a nosebleed, just smell iron or copper. If this happens regularly, check your blood pressure at home or ask your doctor to monitor it. Keep your nasal passages moist with a humidifier or a saline spray, especially while sleeping. And don't ignore headaches, dizziness, or blurred vision. These could be signs that your blood pressure is too high and needs attention. Another red flag smell that's often dismissed is a sour, yeasty odor in women, particularly after the age of 60. Hormonal changes during and after menopause can alter the balance of bacteria and yeast in the vaginal area. A strong or sour smell may indicate a yeast overgrowth or bacterial imbalance, both of which are treatable. But it can also be a sign of thinning vaginal tissue, which becomes more prone to irritation and infection with age. Don't suffer in silence. There are gentle, hormone-free treatments, as well as prescription options your doctor can suggest. Wearing breathable underwear, avoiding harsh soaps, and using a probiotic designed for women's health can all help maintain balance. Let's not forget the sense of smell itself. A sudden change in how things smell to you, for example, if familiar foods start smelling bad or strange, can also be a warning sign. In older adults, loss of smell isn't always about nasal congestion. It may be one of the earliest signs of cognitive decline. In fact, research has found that people over 65 who lose their sense of smell have a higher risk of developing Alzheimer's or other forms of dementia within 5 years. That doesn't mean every case of reduced smell is a crisis, but if you or someone close to you notices this change, especially if it's accompanied by memory issues or confusion, it's worth mentioning to your healthcare provider. Keep your brain stimulated with puzzles, learning new skills, or even exploring new scents through cooking or essential oils. The nose and the brain are more connected than you might think. Now let's take a moment to bring this all together. It's easy to dismiss changes in body odor or smell as something minor or embarrassing. But your body is incredibly intelligent. It sends out signals long before serious symptoms appear. Whether it's a fishy scent, a sweet breath, or a strange metallic tang in your nose, each of these changes could be a clue. The earlier you spot it, the more power you have to respond, with simple daily choices or with a timely doctor's visit. And here's what I want you to remember. Your body is not breaking down. It's speaking to you. Even at 60, 70, or beyond, healing is still possible. Your organs want to do their job. Your cells still respond to care, hydration, rest, and the right nutrients. You don't need to be perfect. Small steps, taken consistently, are what truly change the game. So now I'd love to hear from you. Which of these signs surprised you the most? Have you ever noticed a strange smell and realized later it was linked to your health? Leave a comment. Your experience might help someone else. And if you found this helpful, don't forget to like the video, subscribe, and share it with someone who might need this information today, especially if they've been ignoring changes in their body. This could be the wake-up call they need. And if there's a topic you'd like us to cover, digestion, brain health, heart tips, or something you've always wondered about, let us know below. Your questions drive what we talk about next. Take care of your body. It's the only place you have to live, and sometimes the nose knows best.